How to get rid of my under eye bags. Hello, I'm 32 and have quite bad under eye bags. The makeup is not working very well to hide it. I am wondering if fillers would be a good idea. If so, what kind of treatment exactly? I really need some help. My look makes me depressed and I'm losing confidence, and the more I cry, the worse I look.
Thank you for your question. You're trying to get rid of under eye bags, and you state something really clearly that makes the diagnosis more apparent. And that's saying that when you stated that makeup makes the eye bags look worse. Essentially, makeup, although its intention is to try to blend and hide something, very often will accentuate something that you're trying to hide. The reason is that the under eye bags is something called lower eyelid fat prolapse. What that means is the fat pockets that are normally around the eyes, in your case the fat pockets that are towards the inner corner of the eyes, have pushed forward and they create this bulge. And as you know, creams and makeup don't change that appearance. Now, this doesn't mean that this is the only solution, because the under eye area is not just limited to the eye bags. When I look at your photos, I also notice there's a little bit of a volume loss below the area of the under eye bags. And so you may need more than one type of treatment to achieve a certain goal. In our practice, what we do first for someone like yourself is we would address the fat pockets. We'd also address the skin quality. We typically combine a procedure called transconjunctival blepharoplasty. That means addressing these fat pockets from the inside of the eyelid. When we do that, we also want the skin to look refreshed. And so we'll combine the procedure with fractional CO2 laser and the use of platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's a concentration of the healing growth factors for wound healing. And so the synergy of this combination results in no more bags, as well as an improvement in skin quality and texture. Fractional CO2 laser is a way to improve the fine lines and wrinkles that are on the superficial skin, that when you apply makeup, the makeup will go on more smoothly. Now, in terms of strategy beyond that, you may also want to consider doing something to improve volume in the cheek area. As we get older, we lose volume in the mid-face, and this area can really make you look like you're tired. So, addressing the fat prolapse and the lower eyelid skin may take you to where you want to be, and you may want to stop right there. But also entertain the idea of volume improvement in the eyelid cheek area. I always think of this because I also do facelifts, and I also do a full body cosmetic surgeon. And when I look at the eyes, I also think of the volume in the cheeks and whether or not there's room to address that to create the most optimal appearance. This is all subjective, and it's very important that what you think is most important. A lot of times, taking away the negative, the dominant feature that draws your attention, as is obvious by your question, is the puffy bags under the eyes. It may take a stepwise approach. In our practice, not only do we do the cosmetic procedures, but I've actually become essentially the primary care doctor for beauty for my patients, so that we have this ongoing relationship beyond the surgical procedure to provide solutions for the different things, so that the patient doesn't feel that they have to have this segmented approach where they have to see one doctor in one location, somebody else in another for different areas. Integrating all that is, in my opinion, a really good approach to helping people achieve a certain type of result that they're looking for. So, that being said, I think you need to meet with qualified, experienced cosmetic surgeons. If you share this perspective about the primary care for beauty approach, then find someone who you think you can have an ongoing relationship with. In practicing for over 20 years, all my patients and I, we all grow old together, and we figure out new ways to improve things, and I also help differentiate or help them sift through all the hype, of which there is no shortage of. So with that being said, I think that you're on the right track by asking the question, but addressing the lower eyelid fat pockets and skin quality in combination, I think, will be probably the ideal first step for you to get you to where you want to be. So I hope that was helpful. I wish you the best of luck. Thank you for your question.